Well, thank you, Wayne, for having me here. In terms of the bladder and the prostate, I think the main thing is thinking about the bladder. Just like you've been sounding that alarm for such a long time now. And I think resonating with urologists that it's not just about the prostate, it is protecting the bladder. And the way we protect the bladder is to de-obstruct it, by treating the prostate. And the best way to treat the prostate is not with medications, is with some type of anatomical intervention, whether it's something very small with a mist or something resective like TERP or aquablation. And we really need to treat men at that prostate level first.
And moving forward, if there's just one takeaway that or things that they can take to their clinics right now, one actionable item they can do right now to help patients and providers understand it is about bladder health, kind of what do you recommend?
I recommend kind of get out of the auto pen mode and just don't write Flomax, Flomax, Flomax. And if there's anything where the IPSS score or the IBPSS score is anything over 8, just stop and think, should I evaluate them? And so it doesn't mean doing a procedure, but just evaluate, meaning evaluate anatomy, evaluate the size, evaluate the bladder. So for us, doing a volume study, doing a flow study, and doing a cysto, if you can do those 3 things, I think you're going to arm yourself with way more data to make the right decision for your patients.
And now that the IBPSS has those 2 added questions about stage 3 urgency incontinence, stage 4 acute retention, does that add value for your patients and your care?
I think so. I think if you have these singular types of criteria, that whether it's an APP or a surgeon, they'll make them pause and stop. It's that yellow flag saying, hold on, let's see what's going on here. Then that is going to make a big difference because sometimes there's too many data points. But if you focus on 2 key indicators, and that indicator being urgent incontinence, that being acute retention, saying, okay, these are not people who just get a refill on their meds, they get an evaluation. I think that's super helpful to dial in on very specific criteria like that.
Hey, well, Defender Park, thank you so much. Obviously, you're a champion of the Lug Pub Brigade, and let's go save more bladders.
Let's do it.